Gestational diabetes is a disorder diagnosed in about 4% of pregnancies in which hormones released by the placenta block insulin production, therefore creating an increased amount of glucose in the blood. In gestational diabetes, hormones like estrogen, cortisol, and lactogen are released from the placenta, prohibiting the body from producing sufficient amounts of insulin, which helps turn glucose into energy. The body needs about 3 times the regular amount of energy during pregnancy, but these hormones often debilitate the pancreas from functioning properly. Because of this, the glucose does not enter into the cells and overpopulates in the bloodstream.
Women who are particularly at risk for developing
gestational
diabetes are those who have had previous history of diabetes, are older than 25 at the time of their pregnancy, have a history of high blood pressure, are overweight prior to pregnancy, have had a previous stillbirth or miscarriage, or have given birth to a child weighing 9 or more pounds.
Most pregnant women actually don't realize they have gestational diabetes. They don't experience any symptoms. Occasionally you may have a patient who comes in and says that she's been thirstier, feels like she needs to drink more frequently, or that she needs to urinate, go to the bathroom more often. Sometime near the 28th week of pregnancy, we will give our patients what we call a glucola test, and there are certain levels that we look for, and if it's above those levels, then there is a follow-up test. It's called a 3-hour glucose tolerance test. They get a fasting blood sugar, and then we give them another drink that's a little bit higher dose of sugar, and then every hour for 3 hours after that they have to get their blood drawn. If 2 or more of those blood values are elevated, then they're diagnosed with gestational diabetes.
With gestational diabetes, the most important thing is to make sure the baby is healthy with regular checkups. One of the most common ways to monitor the baby in a mother with gestational diabetes is the non-stress test, in which a machine monitors and displays the baby's heartbeat and compares patterns of heartbeats to the baby's movements. The mother should frequently check and try to regulate her blood sugar as much as possible. One of the easiest ways to do this is through controlled diet and exercise. It is important to regulate fat and protein intake and eat things like fruits, vegetables, and complex carbs, while almost eliminating sugar intake. Some women will still be prescribed medication for their diabetes.
One of the major risks is that we're worried that she could have a large baby that potentially she wouldn't be able to deliver vaginally and then would necessitate a C-section. Another risk is that women who have gestational diabetes are actually at increased risk of developing diabetes later in life, type 2 diabetes.
However, most babies are perfectly healthy. Baby book and I cannot lie.